So it's early on a Friday morning and I've just arrived outside to start my theatre list, my favourite day of the week. And an Ask ID has actually come in saying I'm due to have a biopsy soon and I'm a little bit nervous. Can you give me any explanation as to what will happen on the day to maybe put my mind at rest? And this is really common, that when we say to people they have to have something removed or have to have a skin biopsy to check a lesion, all they can do is think about it. But just to reassure people that a skin biopsy is a very minor procedure, and the paperwork on the day will actually take longer than the procedure itself. So for anyone who's going into hospital, of course, there's a lot of unknown, and especially for people who don't like needles, it often does involve a needle. So a lot of people would be nervous before a procedure such as a skin biopsy, but to be reassured that most people, once it's done, say, is that it? So really what will happen is you will obviously check into the hospital on the day. There will be some paperwork first, and then when you're called into the minor ops room again, you'll be double checked, check the date of birth again, and then you'll be positioned on the bed. So just to reassure people that you really don't have to do anything specific in advance of a skin biopsy. It's really important that if you're on a list of medications, that you take all of them. You don't need to stop your medication, and also it is important that you would eat and drink before a procedure, because sometimes people get a bit nervous, they feel a little bit weak at the thought of a needle. So it is important that you have some food inside you. And if you're going to have any procedure around the mouth, for example, make sure you've had your tea or coffee before you come in, because you will be numb, a bit like going to the dentist in that area afterwards. So it's important that you don't drink a hot tea or coffee so you don't burn yourself because you can't feel it properly. So once you've gone through the consent with your doctor, you'll then have some local anaesthetic put in. And again, this is the worst part of the procedure. It is a little bee sting. It only lasts for seconds because we're literally taking a tiny little piece of skin, so we don't have to numb a large area. And then we allow that to work for a few minutes. Then you'll be prepped, so you'll be put into the position for the biopsy. The area will be cleaned and we put a little drape around it, and then you'll have the procedure done. And during this time, you'll be chatting away to either someone like myself or the team of nurses, usually talking about the weather for the most part, and it'll be over before you know it. We cover the area with a little dressing, and then we go through the aftercare. And it is important that you would protect the area. So very quick showers, not soaking in a bath, not swimming. And depending on the location, there may be some other aftercare. The dressing is usually left in place for days. And depending on if you have absorbable stitches or stitches that have to be removed, we will talk you through that. But the absorbable ones will essentially absorb and fall out themselves. But I usually get patients to put a little bit of Vaseline on them to help with that healing process. So again, to be reassured, a skin biopsy sounds like a big deal, and actually, as I said, most patients just say, is that it? Is it over? So it's a very minor procedure.